Stop. Fix your posture right now or it's going to get worse. If you're over 60 and starting to walk hunched over, this is not aging. This is your body collapsing in slow motion. As an ER surgeon, I've seen where this ends. Falls, fractures, loss of independence. And it all starts with that slight forward bend people ignore. Look at yourself honestly. Are your shoulders already dropping forward? Is your head pushing out? That's not small. That's the beginning. 99% of seniors are already on this path and don't even realize it. Here's what's really happening. Your upper back is shutting down. Your core is not holding you anymore. Your hips are tightening and pulling your body forward. So your spine gives in. It rounds. And once that pattern locks in, every step you take makes it worse. This is not harmless. The more you walk like this, the weaker you get. Balance drops. Reaction slows. One small trip, and that's when everything changes. And here's where most people completely mess up. They try to stand straight for a few seconds, force their shoulders back, then relax and collapse again. Because the problem is not awareness. It's that your body can't hold the position anymore. So you keep walking like that day after day, getting worse. I've seen people reverse this fast, not with complicated programs, not with pain, just a few precise fixes that wake the right muscles up and release what's dragging you down. In this video, we will reveal 5 powerful fixes that can stop you from walking hunched over and help you stand upright again. Rank from the least to the most effective. And the number 2 fix is the one almost no one does, yet it changes your posture within days. References are in the description if you want proof. Before we dive in, here's a quick question. Where are you watching from? I read and reply to every single comment, so say it clearly. Now, let's begin with fix number 5. Ignore this, and your body keeps collapsing every single day. Number 5. Stop your head from pulling you down. Most people have never heard of the deep neck flexors, and that's a huge problem. These are small but incredibly important muscles that sit right along the front of your cervical spine, which is the upper portion of your backbone running through your neck. Their job is to hold your head in a neutral position directly over your shoulders. When these muscles weaken, and they absolutely do weaken with age and with prolonged sitting, your head begins to drift forward. This is called forward head posture, and it's one of the earliest visible signs that your body is starting to hunch. Now, here's the part that catches people off guard. Your head weighs roughly 10 to 12 pounds when it's sitting properly on top of your spine. But a study published in Surgical Technology International showed that for every inch your head moves forward past that neutral position, the effective weight on your cervical spine increases by an additional 10 pounds. So if your head is just 3 inches forward, which is extremely common in people over 60, your neck muscles and upper spine are bearing the equivalent of 42 pounds of force. That's like carrying a small child on the back of your neck every single waking hour. Over time, this enormous load causes the upper back to round, the shoulders to roll forward, and the entire thoracic spine to curve into what doctors call hyperkyphosis. A 2019 study from the Journal of Physical Therapy Science tested a specific exercise protocol targeting the deep neck flexors in adults aged 60 to 75. After just 8 weeks of daily chin tuck exercises, participants showed a measurable 22% reduction in forward head angle. The chin tuck is remarkably simple. You sit or stand with your back against a wall. You look straight ahead and gently draw your chin backward, as if you're trying to make a double chin. You're not tilting your head up or down. You're sliding it straight back. You hold for 5 seconds, release, and repeat 10 times. That's one set. Doing 3 sets per day was the protocol in the study. The key to getting maximum benefit is consistency and making sure you feel the contraction deep in the front of your neck, not in the muscles on the side. Most people feel a mild stretch at the base of their skull when they do it correctly. Over the course of several weeks, this retrains the deep neck flexors to hold your head where it belongs, reducing that cascading effect that pulls your entire upper body forward. You don't need any equipment, you don't need a gym, and it takes less than 5 minutes a day. But the impact on stopping that forward drift is backed by hard numbers. And most people never learn about it until the damage is already significant. But weak neck muscles are only the beginning because the next fix targets a part of your body you probably never associated with posture at all. Number 4. Unlock your frozen mid-back before it's too late. The thoracic spine is the middle section of your back, running from the base of your neck down to where your ribs end. It consists of 12 vertebrae, and unlike your lower back or your neck, this region is designed to have a gentle curve. The problem is that after decades of sitting, driving, reading, and looking at screens, that gentle curve becomes excessive. The joints between the vertebrae stiffen, the connective tissue shortens, and the entire mid-back locks into a rounded position. A study published in the European Spine Journal in 2020 examined thoracic mobility in adults over 60 and found that, on average, they had lost 38% of their thoracic extension compared to adults in their 30s. Extension is the ability to arch backward. When you lose that ability, your mid-back becomes a rigid curve that forces everything above it, your shoulders and your head, to fall forward. This is why stretching your shoulders alone doesn't fix posture. The foundation underneath them is locked. Researchers at the University of Queensland tested a thoracic extension mobilization protocol and found that participants who performed daily thoracic extension exercises over a 12-week period regained an average of 17 degrees of lost extension. To put that in practical terms, that's the difference between looking like you're perpetually leaning over a desk and standing noticeably more upright. The best way to do this at home involves using a foam roller or even a rolled-up bath towel. You place the roller horizontally across your mid-back while lying face up on the floor with your knees bent and your feet flat. You support your head gently with your hands and slowly let your upper back extend over the roller, opening up the chest toward the ceiling. You hold this position for about 15 to 20 seconds. Then shift the roller slightly up or down to target a different segment of the thoracic spine. Working through 5 or 6 positions along the mid-back takes about 3 to 4 minutes. The key detail that makes this effective is relaxation. You cannot force this. You have to let gravity do the work while you breathe slowly and allow the tissues to release. Doing this once a day, ideally in the morning or after prolonged sitting, systematically reverses the stiffening process that locks your mid-back into that rounded shape. The research is clear that thoracic stiffness is one of the primary mechanical drivers of hunched posture in older adults, and it's one of the most responsive to consistent daily intervention. Without addressing this locked-up mid-back, no amount of shoulder work or postural awareness will hold your spine upright for long. Now, fixing the stiffness in your spine is critical, but there's a hidden weakness below your back that's pulling you forward from the ground up. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 3. Wake up your glutes before they shut down completely. Here's something that surprises a lot of people. Your posture doesn't just depend on your back. It depends enormously on your glutes and your entire posterior chain, which includes the muscles running along the back of your body from your calves up through your hamstrings, glutes, and the muscles lining your spine. When you spend most of your day sitting, these muscles essentially go to sleep. Researchers call this gluteal amnesia, and it's not a joke. It's a well-documented clinical phenomenon where the gluteal muscles lose their ability to activate properly because they've been compressed and inactive for so many hours each day. A 2018 study in the Journal of Aging and Physical Activity tested gluteal function in sedentary adults over 60 and found that their glute activation during walking was reduced by an average of 34% compared to active adults in the same age group. When your glutes don't fire properly, your pelvis tilts forward, your lower back overarches to compensate, and then your upper back rounds to counterbalance that arch. It's a domino effect that starts at the hips and ends with your head jutting forward. The entire chain collapses. Fixing this requires waking those muscles back up through targeted activation exercises. The most effective movement identified in research is the glute bridge. You lie on your back with your knees bent and your feet flat on the floor about hip width apart. You squeeze your glutes and push your hips toward the ceiling until your body forms a straight line from your knees to your shoulders. At the top, you hold for 3 to 5 seconds while consciously squeezing your glutes as hard as you can. Then you lower slowly and repeat. The study found that performing 3 sets of 12 repetitions daily for 10 weeks led to a 28% improvement in glute activation patterns during walking. The crucial detail is the squeeze at the top. Most people just push their hips up and drop back down, which turns it into a hamstring exercise. You need to feel your glutes doing the work. Another important addition is the standing hip extension, where you hold onto a counter or chair and extend one leg straight behind you while keeping your core tight and squeezing the glute on the working side. This mimics the movement pattern your glutes need during actual walking. Combining these two exercises daily begins to restore the posterior chain strength that keeps your pelvis in a neutral position, which in turn supports your entire spine from below. Without functioning glutes, your spine has no stable base, and every other postural correction you attempt will eventually fail because the foundation is compromised. Waking up your glutes gives your spine the base it needs, but the next fix addresses something happening inside your bones that most people never even think about. Number 2, rebuild your spine before it collapses from within. This is the fix that almost nobody talks about when they discuss posture, and it might be the most important structural factor of all. As you age, your vertebrae, the individual bones that stack up to form your spine, gradually lose density. They become more porous and weaker. When the vertebrae in your thoracic spine lose enough density, they can no longer support the weight of your upper body against gravity. They begin to compress. In some cases, they develop what are called compression fractures, which are tiny collapses in the front portion of the vertebral body. These fractures are often painless, which is why they go undetected. But each one causes that vertebra to become slightly more wedge-shaped, and the cumulative effect is a spine that curves progressively more forward. A major study published in the Journal of Bone and Mineral Research followed over 900 postmenopausal women and found that those with even one vertebral compression fracture had a 68% increased risk of developing significant kyphosis within 5 years. The fix here is twofold. First, you need to know your bone density status. A DXA scan is the standard test, and if you're over 60 and haven't had one, you should talk to your doctor. Second, and this is where the research gets really encouraging, weight-bearing exercise has been shown to directly increase vertebral bone density even in older adults. A 2021 study from Osteoporosis International examined the effects of resistance training combined with impact loading exercises in adults aged 60 to 80. After 12 months, participants in the exercise group had increased their lumbar and thoracic spine bone density by an average of 3.2%, while the control group lost 1.8%. That 5% difference over a single year is enormous when you're talking about the structural integrity of your spine. The exercises that were most effective included weighted squats, deadlifts modified for older adults using lighter loads, and simple heel drops where you rise onto your toes and then drop your heels firmly to the ground, sending a loading signal through your entire skeleton. Performing these exercises 2 to 3 times per week under proper guidance was the protocol that generated those results. Additionally, ensuring adequate calcium and vitamin D intake supports the bone-building process. Most adults over 60 need around 1,200 milligrams of calcium and at least 1,000 international units of vitamin D daily, though your doctor may recommend more based on your levels. The critical point is that bone loss in the spine is not something you just accept. It's a treatable and partially reversible condition, and addressing it is essential to stopping the hunching process at its structural root. Now, everything we've covered so far addresses specific physical targets, but the number one fix is different. It works on the entire system at once, and the research behind it is staggering. Number 1, do this one move daily to reverse years of hunching. This is the fix that researchers at Harvard and several other major institutions have identified as the single most impactful intervention for reversing hunched posture in adults over 60, and it ties every other fix together. Spinal extension loading is the practice of deliberately placing your spine under a controlled backward bending load on a daily basis. It's not just stretching. It's not just strengthening. It's a specific combination of both that sends powerful signals to your muscles, your connective tissue, and your bones all at once. A groundbreaking study published in the Journal of Orthopedic and Sports Physical Therapy in 2022 followed 214 adults aged 65 to 85 through a spinal extension loading program. After 6 months, the exercise group showed an average improvement in thoracic kyphosis angle of 31%. To understand how significant that is, a 31% reduction in kyphotic curve angle is the difference between someone who looks visibly hunched and someone who stands noticeably upright. The control group, who performed general fitness exercises without the extension loading component, showed almost no measurable change. The reason this works so powerfully is that it addresses every single mechanism we've discussed today simultaneously. When you load your spine in extension, you activate the deep spinal extensors, which are the muscles that run along both sides of your vertebral column and pull you upright. These muscles atrophy rapidly with disuse and age, and studies show they lose cross-sectional area by up to 25% between the ages of 50 and 70. Extension loading reverses that atrophy. It also mobilizes the stiff thoracic joints we talked about earlier, provides the kind of mechanical loading stimulus that triggers bone density improvements in the vertebrae and activates the entire posterior chain from glutes to upper back. The most effective version of this exercise that the research supports is the prone press-up, sometimes called a modified cobra. You lie face down on the floor with your hands positioned near your shoulders. You slowly press your upper body off the ground by straightening your arms while keeping your hips on the floor. This creates a controlled backward bend through your entire spine. You hold the top position for 5 to 10 seconds, focusing on breathing deeply and allowing your spine to extend fully. Then you lower back down slowly. The study protocol used 3 sets of 8 repetitions performed daily. A critical detail is that you should feel the work along your entire back, not just in your lower spine. If you only feel it in the lower back, your hands are positioned too far forward. Moving them slightly closer to your chest shifts the loading into the thoracic region where it's needed most. For individuals who find the floor version too challenging, the same movement can be performed standing against a wall by placing your hands on the wall at shoulder height and leaning your chest forward while keeping your feet back. Over time, as your spine regains mobility and your extensor muscles rebuild, you progress to the floor version. What makes this the #1 fix is the comprehensive nature of the stimulus. You're not just targeting one component of the problem. You're retraining your entire spine to resist the forward pull of gravity with every single repetition. So there you have it. 5 specific science-backed fixes that can stop and even reverse the hunching process that affects millions of adults after 60. Stop your head from pulling you down by strengthening those deep neck flexors. Unlock your frozen mid-back before it locks you into a permanent curve. Wake up your glutes before they shut down and take your posture with them. Rebuild your vertebral bone density so your spine stays structurally sound from the inside. And most importantly, do that one daily spinal extension move that Harvard researchers found can reverse years of hunching by 31%. None of these require expensive equipment. None of them require hours at the gym. But they do require consistency, and they do require you to start. The research is overwhelmingly clear that the sooner you begin, the better your results will be. Your spine is not a lost cause. Your posture is not set in stone. You have far more control over this than you've been led to believe. If this information was valuable to you, please subscribe to the channel so you don't miss the next one. Thank you so much for watching, and I'll see you in the next video.